So the first time I learned about PrEP was about 2014, and it took me about a year or so to really find the courage and inspiration to talk to my provider. Well, once I spoke to my provider, I've received a lot of pushback. They didn't feel like I was at risk, and they also weren't knowledgeable about PrEP at all. And so they were really hesitant to prescribe it to me.
Just going to any medical facility to talk about me and my body and how I identify was just scary back then. There wasn't a trans health center. There wasn't, back then LGBT centers weren't really friendly to trans folks.
The first doctor I went to pretty much said he didn't know anything about it and wasn't willing to do anything with me. The second one was a really bad experience in which he wouldn't touch me. He tried to refer me to an infectious disease specialist, even though he knew this was a preventative measure. He treated me like I was, going to give him something. And it made me feel very uncomfortable.
The stigma with just being a trans woman, period. I have to disclose my HIV status and say that I am a trans woman not living with HIV.
I cannot tell you how many times I've had clients who have gone to other providers feel judged for wanting to get on PrEP.
I had a conversation with my primary care physician who wasn't at all familiar with PrEP.
So the first doctor I went to in Nashville basically said no. He said that he was not comfortable with prescribing that medication and referred us to a disease specialist, which is crazy. So I went to another primary care physician, and she was okay with it, but she did want to do her own research. She was unfamiliar with the medication and what it would be prescribed for.
From that conversation, I walked away thinking that at this point, it might be time for me to switch my overall primary care physician.
Having a medical professional not even be willing to touch me, he didn't even finish the exam, made me feel very less than and very misunderstood. And I was frustrated because I didn't know where to go from there.
I also worked in sexual health, and so I really felt I really wanted to advocate for myself to get on PrEP, but it took them a while before they were convinced enough to prescribe it to me.
So there's definitely a lot of stigma when it comes to PrEP because people assume that you're just having sex with any and everybody.
For example, I heard the term Truvada whore being thrown around quite a bit.
And people just really don't understand that you can empower your sexual health.
Obviously, there's a lot of stigma around, people thinking anyone on it is going to be extra promiscuous or whatever.
I'm a very big proponent on sexual health as well as sex positivity. So I've been extremely open to all of my friends and family about my PrEP use.
I think that I've only told my mom, and it's because we don't want people to assume that even though we're married, we're in a promiscuous relationship. That's just not true. We're trying to be forward thinking about our own health, but it is hard to share that information with others because of our concern about how people may perceive us.
When I first started taking PrEP, I did encounter a few challenges related to getting the prescription.
In New York City, I never had an issue refilling my prescription for PrEP. But when we moved to Nashville, that stopped being the case.
I seem to remember a lot of issues with getting the medication once I had a prescription in Tennessee. Most of the issues came with smaller town pharmacies that did not keep the medication in stock.
It was hard to wonder whether or not the pharmacy would even have the medication when it was, available to fill. And then if they did, would they even give me what was prescribed? And so that was definitely a major struggle.
I think it's important to the providers that they understand, again, yes, PrEP is a choice, but empower with education, empower with the knowledge without judgment.
And so for me, it was finding the doctors at UCSD that are trans affirming and just really wanted the best for me, finding that care in those cis providers, those cisgender providers, medical providers, and them letting me know, Deja, bring your friends, we will take care of them. They don't have to worry about being misgendered. They don't have to worry about, just all we want to do is make sure that they continue to stay safe and their sexual health is important.
A patient really does sometimes understand what their needs are, and that the job of the patient-doctor relationship should really be to work together in order to better a person's overall health. And so I would suggest to my doctor to make sure that they do their research and sometimes to kind of check some of their bias at the door.